Hi everyone, welcome to this brief overview of the Introduction to Art Therapy. My name is Mira Rastogi. I am a licensed psychologist and a board-certified registered art therapist, and I teach through the University of Cincinnati. I also see a few clients for psychological therapy, and then I run art therapy groups. And so I'm going to give you a brief overview of what art therapy is, how it's defined. I'll talk about the history of art therapy, as well as talk about how to develop a career in art therapy and some ethical issues to consider. I do hope you find this interesting, and I look forward to hearing from you from emails or questions that you want to ask, and I'm more than happy to connect you to more information. Here's a quote by Judy Rubin, who's still alive, who is also a psychologist and an art therapist. She said that art therapy in the fullest sense requires combining a deep understanding of art and the creative process with an equally sophisticated understanding of psychology and psychotherapy. And this merging of the two fields of arts and the creative process and psychology and psychotherapy forms the base of art therapy. And so we're going to talk a little bit about how these two fields have combined to form this new area called art therapy. So you might be wondering first, what is art therapy? Where did it come from? What is the profession like? And so we're going to cover a few of those elements. So first of all, art therapy combines a knowledge of psychotherapy and psychology and fine arts. And so these overlap and create the field of art therapy. So an art therapist needs to have an understanding of psychological theory and models of helping people, understanding mental health, of working with people. They also need to understand developmental stages, which you probably have studied in psychology classes, of how people's thinking develops, how their body and their identity develop, as well as understanding mental health. And so those are the components of the psychology piece that is really important to art therapy. Now, art therapists also need to know about fine arts and media. And so art therapists need to be aware of the art making process of how things go from thinking or feelings into creating. They also need to understand basic media. And art therapists need to at least have some exposure to how to painting, how to draw, drawing, and how to work with 3 dimensions, usually clay. And so those are the elements of fine arts that an art therapist has to know about. Art therapists combine their knowledge in these two areas to apply psychological techniques using fine art tools to help people. And so this is where you see Dr. Judy Rubin's ideas that art therapists need to know both psychology and psychotherapy and creativity and the arts. The current definition of art therapy is defined by the American Art Therapy Association, and they define art therapy as a mental health profession that enriches the lives of people using the creative process, psychological theory, and the human experience within a psychotherapeutic relationship. And so many art therapists are trained as mental health professionals, and that's what differentiates them from being an artist. Or just being a therapist, is that they combine the creative process in art making and a psychological theory, and they are mental health professionals. In the United States, in order to call yourself an art therapist, you need to have a master's degree in art therapy. So where did art therapy come from? So we're going to start with the history of art therapy, and one art therapist described the history of the field as that all of these threads are combining together to form an image. So just like if you sew something, you have individual elements, but they all work together to create their own entity. And so we have been expressing ourselves using art for 40,000 years. We have found cave art from prehistoric times where cave people have figured out how to create pigments, have figured out how to use a stick or something as a tool, and figured out how to represent people and animals for some purpose in caves. So in addition to these prehistoric times of creating and symbolizing things through drawing, we also see other things, art materials, music materials from the Paleolithic period. In ancient Egypt, we see people expressing themselves through the arts with music and chants. And in the Greek Roman Empire, people writing about the effects of music. And in ancient China, using music and dance-based movement for healing. So people have been using all kinds of forms of expression and arts, very richly woven into our cultures in what we wear, how we do things, how we decorate things as forms of expression, beauty, and enjoyment. So now we're going to talk about some of the core influences that have been documented as forming the base of art therapy. So while we know people have been creating and expressing themselves for many years, the field of art therapy is fairly new in a formal sense. And so we began with psychological influences on art therapy. And we're going to focus mainly on Freud and Jung. We will talk a little bit about Max Simon and Prinzhorn, and we will not talk about Cajal. Um, and so psychoanalysis formed the basis of the theory behind art therapy, starting with Freud, who focused a lot on symbols in dreams, noting that symbols that are in our dreams. So if you think about the times when you've dreamt, what are the colors that were dominant? Were there any particular objects or people that stood out? All of those Freud believed were some form of highlights of our unconscious and things that we were unaware of. And so he was really focused on how things can be used as symbols to tell us more about something somebody is unaware of. Carl Jung, who was a student of Freud, developed this idea of the arts even further. And Jung actually, when he had a falling out with Freud, started processing his own struggles visually. And so you can see one of his paintings here in something called the Red Book. And he spent time doing drawings and using those to reflect on things that he was struggling with. And what he found is that art could be used for himself to help him gain insight, and that artwork and creating could also be used by his patients. And he really found artwork to be helpful for his patients to continue working on things while they were not in session. Anna Freud actually mentored a really well-known art therapist, Myra Levick, who was the first American art therapy president. And Myra Levick worked under Anna Freud and further used psychoanalysis to develop some art therapy tests and techniques. Paul Max Simon and Hans Prinzhorn were both psychiatrists who looked at patient drawings, and they found patient drawings really interesting. So again, we find this interest in art making and mental health and insight with psychoanalysis. And then we also saw the connection between psychology and arts through psychiatry. Prinzhorn, who you see in the picture in the upper right, was an art historian and a psychiatrist, and he was fascinated with patient drawings. And so he collected over 5,000 pieces, which he published in a book called Artistry of the Mentally Ill. And it's fascinating. And there is a documentary where you can see some of these films created by patients, and there is still a museum that you can go see a lot of these works, but they're very fascinating. And this was just a beginning of where you would see the connection between medicine and art making and psychiatry and art making. That really has lasted for years afterwards, even to up to today. Both of these, psychoanalysis and psychiatry, forming the basis of what we now know as art therapy. The person who is considered the founding mother of art therapy is a woman by the name of Margaret Nomberg. She was the first in the United States to use the term art therapy, and she practiced psychodynamic art therapy and wrote about her practices, which were very psychoanalytically based. And she would look at underlying meanings and transference, where a person takes their own psychological issues and expresses it through the art and use it as a form of psychotherapy. Her sister, Florence Kane, used art differently. She used art making as a distraction, as a form of relaxation for people, and looked less at analyzing people's work and more at using art as a way to redirect yourself from your emotions or to calm yourself down. These two ways of approaching art therapy are still seen today, and we'll talk a little bit about that in a moment. These two competing aspects, which you see with those historical founders, Kane and Nomberg, can be seen in the art in therapy, which is what Florence Nomberg used, which is a form of art psychotherapy where you use art as a way to look at what people might be unaware is going on with them. Whereas Florence Kane used art materials as soothing, distracting, helping somebody feel better. And you might be able to see those two aspects in your own artwork, where your artwork helps you understand something deeper about yourself, or your artwork helps you center yourself and ground yourself and calm yourself. So both of those are used in art therapy. For an example of each of these two aspects, art and psychotherapy, we believe that art is like a window to the unconscious and gives insight, and the client's interpretation is important. And so you might ask somebody to draw what has power over them, draw their self-talk. Those are trying to gain insight, work through a problem. Art as therapy is for soothing, distraction, calming. So you might ask somebody to paint to reduce their anxiety, or draw. Learning how to draw can build self-esteem. You might wonder what art therapists do. And just like this image shows, this is really typical art therapists. They help with the client, guiding them to choose, initiate, and help assist them in the art making process. The one big key is facilitating a sharing of the experience. They might also use artisan assessment. So when somebody arrives in a hospital and they're feeling really unstable, you collect some artwork from them, and then when they're ready to leave the hospital, what does their artwork look then? And you can see a big difference. Contrary to popular belief, we do not focus on reading drawings. We facilitate questions to talk with the client to get them to understand and gain insight from their drawings. So in this section, we're going to talk about how art therapists choose art materials, which we call media, art media, and the different properties that art media possess and how those affect one's psychological state. We also look at the power of artistic media, and we can use artistic media to help with a client's state. And so art therapists know that using more fluid, free-flowing, less controllable materials tends to heighten people's emotions or affect, and using more resistive materials that require more control, like pencils or pens, it helps stimulate somebody's thinking or feelings of more control. So if somebody's really having a hard time expressing themselves, we might want to use more fluid materials. If somebody's overly expressive and may feel more emotionally out of control, we might try something more resistive. And we also find people tend to be more attracted to different materials depending on if they prefer a more logical style or if they prefer a more feeling style. And here are some examples of some resistive versus fluid materials and something that falls in between. So on the right you see pencils, and on the left you see paint, and in the middle might be chalk pastels. Next, we're going to talk about something called the Expressive Therapies Continuum. The Expressive Therapies Continuum is a main theory of art therapy, and the Expressive Therapies Continuum looks at what type of materials people are comfortable with, and also how might we work with materials to help stimulate different brain functions and also emotional functions. And this theory also helps communicate among art therapists. And so the way this theory works is that the lowest level, the most simplistic level, is the kinesthetic sensory component. When you work with the kinesthetic component, that is where you work with art materials using your body, like pounding clay or painting really big. You're using a lot of body movement. That tends to downplay the sensory component. The sensory component is when you finger paint or you work with clay and you really are present with the material. On the next level, people then focus on perceptual, which is the shape or the form, or the affective, which is the emotional aspects. So with the perceptual, you might see something like a still life or the outlines, and affective, you might see a predominance of color. On a more higher level is the cognitive component, which requires some thinking and planning, or the symbolic component, which is creating a symbol that means something particular to you. Like an apple could be a symbol of a teacher. And so when you combine these two aspects, you can then stimulate the creative level where a person feels a sense of flow. All of these levels have a healing function and an emergent function. So the healing function is, for kinesthetic, would be release, and the emergent function, which happens after you're done with the art, you feel relaxation. Also on these levels, you can go to extremes that are unhealthy. So if somebody's moving chaotically with the art materials, they might have some problems related to impulsivity. And so you can really observe the way somebody interacts with the art materials as a form of assessment. And so here are these levels again, and that explains that theory. Now we're going to connect something called the artistic stages of development to psychology, and specifically Piaget's theory of cognitive development, how our brain develops. So we're going to look at how people from various cultures and various parts of the world all develop similar stages of artistic development. We're going to look at one child's example of drawings of a horse, and then we're going to connect that to Piaget's theory of cognitive development. Another thing art therapists use are developmental theories, and how people, just like your thinking changes over time, your maturity level changes over time, so does your artistic stages. And so here is an example of one child's drawings of a horse, where they start off at 4 years old drawing an image of almost like a person as a horse, and as they're getting older, they're able to do more fine-tuned details, and it looks more representational of what you see. But you see the child struggling with shape and details until they gain more fine motor development, more cognitive development to express more details. And what is interesting is, as the stages of development, so here in the second row, we have the artistic stages of development. As a child develops artistically through these stages, they are also developing cognitively. And you see these really parallel each other. As you see somebody's brain development, so does their ability to represent themselves artistically. And so again, you see emerging of the psychology, of the cognitive development, as well as the artistic stages of development. In this next section, we are going to look at how the profession of art therapy is similar and different to other professions. One thing I want to note here is that there are differences between how an art therapist skills are different from an artist versus an art educator and a counselor. And so some of you might be interested in art, some of you might want to be art educators, some of you might even want to be counselors. And so I just want to show you this model. This model shows you how these fields are different and how an art therapist is really trained on multiple levels. So an artist is trained to know knowledge of media and knowledge of aesthetics. So is an art educator, and they're also trained on group dynamics. A counselor is trained on conflict resolution, group dynamics, trauma training, and individual dynamics. And an art therapist is trained in all these ways. So if you want to integrate these different characteristics in your career, art therapy might be a career for you. If you just want to work with the artistic media, then being an artist might be for you. If you don't want to work with the art media at all, then a counselor might be the way to go. So this chart nicely represents ways to differentiate which field might be best for you. This next section talks about ethical considerations. How do we protect client welfare and do what's in the best interests of our clients when it comes to artwork and our clients? So, some ethical considerations when you are doing art therapy is the discussion and handling and exhibiting artwork. These issues are handled differently compared with an art educator versus an art therapist. So, art educators may discuss the artwork, do a critique where they hang all the artwork up on a wall and talk about it. An art therapist focuses more on the process and less on teaching skills or the quality of art. Although we may do some teaching, the focus is not to create a beautiful piece of art. The focus is on the insights gained or the experience and the process of making the art. Art therapists do not interpret, they avoid interpreting. Instead, they will ask their patients to interpret the artwork. And we also try not to make recommendations on the art piece. We try to empower the client to make the recommendations as a way of gaining confidence in their own ability to make decisions. So as an art educator, you might focus more on developing the skills. You might offer interpretations or say that work reminds me of so-and-so, and you definitely are making recommendations. You might try this, you might try that, this color might look better, and that art therapists do not do that. For the handling of artwork, art therapists rarely, if ever, add to the art product. We see the artwork almost as an extension of that person. So we're not going to draw on a person. We're not going to interfere with that. We want the client to be doing the work. And we also handle the artwork as if it's part of a clinical record or a medical record. And so we only share that information with written consent. And we also handle it as if it were an important medical document and have it under lock and key. With exhibiting artwork, we have to weigh the pros and the cons of what's in the best interest of the client. So unlike an artist or an art educator who determines for themselves what they're going to exhibit, the art therapist will work with the client to look at what are the drawbacks of presenting, what are the benefits, how is this going to affect you therapeutically. And you also want written consent where a person signs a form that they agree to have their work exhibited, knowing there may be potential consequences. And we also allow anonymous presentations versus in a formal art setting, although artists may do that as well. Many of you might be wondering, how do I become an art therapist? On this next slide, we're going to look at how do you go from an undergraduate degree to a graduate degree to becoming an official art therapist. So now let's shift over to how you become an art therapist. This is for the United States. So you would want to look where art therapy, how the process might be different. So in the United States, you generally need a bachelor's degree with 18 credits of fine arts and 12 credits of psychology. And this really, the 18 credits of fine arts is mandated by the people the board that gives the license in art therapy, and so that is pretty standard. The 12 credits of psychology depends on the program. So you might check with the programs that you might want to go to for art therapy. Generally, people major in fine arts or in psychology because there's so much overlap. I tell people, pick psychology if you want options to do more mental health or social services. pick fine arts if you want to focus on a career as an artist, art teacher. And so, but the prerequisites for getting into a master's degree generally are these 18 credits of fine arts and 12 credits. For the 18 credits of fine arts, you want to work with different media, but you want to have at least one painting class, at least one drawing class, and at least one three-dimensional class, and you'd want to look at graduate programs to make sure that you have, because some want ceramics, some want sculpture, and you want to make sure which class you need. And then for the other classes, getting some exposure to more of those three areas or other forms of artwork is beneficial, because as an art therapist, you're going to use multiple forms of art media. After you finish your bachelor's degree, you will go on to a master's degree, which takes about 2.5 years to complete or longer. The master's degree, there are approved programs that you would want to look at. There are also programs that are not approved that may include a mental health counseling degree with an art therapy specialization. So there are alternatives to the degrees. If you graduate from an accredited program, you can become a registered art therapist provisional, which just means you've graduated and your courses have been approved by the credentials board, and then you go on to get 1,000 clinical hours supervised. And I think for every 10 hours you complete, you do 1 hour of supervision. After you finish those 1,000 hours, you can apply to become a registered art therapist, or ATR. Once you're a registered art therapist, you can apply to sit for the board certified exam, which is a several-hour exam on the field of art therapy. And there are several study guides. I recommend using the Art Therapy Credentials Board exam outline to form your study guide for the exam. And then once you do the board certification, you have an option to go on, I think, another 100 hours with supervision to become an art therapy certified supervisor. But that is optional and you do not have to do that. Many hospitals might want you to have the board certification, and so that's something to keep in mind for your end goal is what is the requirements for the job in the state or the place where you're living. And again, this is US based, and this might be different, and it also changes year to year. So the best place to go if you want to practice in the United States is the Art Therapy Credentials Board, but you may also want to check in your country or state. Here are some additional resources. You can always go to the American Art Therapy Association website, and there are links on becoming an art therapist, careers in the field of art therapy, and other interesting articles that you might find useful. Their monthly newsletter is very interesting and highlights art therapy around the world, so you might find that interesting. You also might want to look at the Art Therapy Credentials Board, which is the place where art therapists become licensed in the United States. And then you might, if you want more of a foundation of art therapy, you might find the book that I edited with my colleagues called Foundations of Art Therapy, a really good basic background of the field and the profession, and hopefully you find it interesting. If you have any questions, I'm more than happy to answer them. You can see my email below. And if there are any issues or you'd like me to expand on anything in this video, also let me know that as well. Hope you found this information really helpful and informative. And if you have any questions, let me know. Thank you.